Hey, I'm Dr. Shane.
And I am Dr. Ben. Thank you for choosing Heritage Oak Dental to take care of your oral health needs. Today, we are going to talk about a procedure you just had done.
Yeah, fillings. What's a filling?
Basically, we were replacing a part of your tooth that was lost to decay, fracture, or you broke it off on the way to a party. Very, very common. We want to address three main topics with a filling.
So pain. After a filling, typically your tooth is going to be doing well. It might just be a tiny bit sensitive to some hots and colds because we did just do a small surgery. And then most of the pain is going to come from the injection site where we had to numb the tooth.
And we would just recommend taking either ibuprofen or Tylenol, whatever you normally do for mild pain. What can you eat? Essentially, when you leave the office after having fillings done, you can eat pretty much what you want to, okay?
Once you can feel your lip, because you don't want to eat that.
Don't chew off your tongue either.
No, that's bad.
The third thing,
we want you to take care of this like a tooth.
and lastly, how do you take care of a filling? Brush well, floss well. You know, the filling is replacing a part of your tooth that was broken off or decayed, and so there's going to be a seam, edge, and you want to keep that edge very clean. Bacteria are good at what they do, and you will lose a filling quickly if you do not take care of it. So taking care of it at home by brushing, flossing, eating well, and also seeing your hygienist consistently.
That's it.
That's it. Thanks for choosing Heritage Oak Dental. Have a great day.